Senate File 125, a bill authored by Wyoming Republicans ostensibly aimed at curbing abortion access, carries the potential to severely restrict a wide array of life-saving medical procedures. Its broad language, defining healthcare in a manner that excludes any treatment causing harm to vital organs, casts a wide net that ensnares far more than just abortion. The bill's definition explicitly states, "No act, treatment, or procedure that causes harm to the heart, respiratory system, central nervous system, brain, skeletal system, jointed or muscled appendages, or organ function shall be construed as health care." This sweeping definition raises serious concerns among legal experts and healthcare professionals, as many medical interventions, by their very nature, involve some degree of harm or risk to bodily systems in the process of treating an illness or injury. The bill's genesis lies in the November 2024 overturning of Wyoming's abortion bans by State Judge Melissa Owens, who cited the state constitution's guarantee of health care access. Republican State Senator Cheri Steinmetz, along with 8 co-sponsors, spearheaded Senate File 125 as a direct response to this ruling, aiming to redefine health care in a way that excludes abortion. While the bill includes exceptions for life-saving procedures during pregnancy and situations where a patient has no chance of meaningful recovery without the procedure, the vagueness of its language leaves significant room for interpretation and potential miss. The ambiguity surrounding the bill's impact on abortion access stems partly from the lingering effects of the 2023 Life is a Human Right Act, which granted fetal personhood, though this act was subsequently overturned. Experts are divided on the bill's effectiveness in achieving its stated goal of restricting abortion. The problem, as highlighted by attorneys and healthcare law professionals from prestigious institutions like Boston University, George Washington University, Johns Hopkins, and the University of Pittsburgh, is not necessarily in the intent, but rather in the disastrously broad interpretation of harm. A chemotherapy regimen, for instance, deliberately harms cancerous cells to save a life. A heart surgery inherently involves some degree of trauma to the heart. The bill's definition, in its current form, arguably encompasses a vast range of necessary medical procedures. The introduction of Senate File 125 is not an isolated incident. It is part of a broader legislative push by Wyoming's Freedom Caucus, reflecting a national conservative agenda that prioritizes social issues. This agenda includes initiatives to dismantle diversity, equity, and inclusion, DEI, programs, enforce stringent gender definitions, implement restrictive immigration policies, and enact a multitude of abortion restrictions. This pattern aligns with a broader national trend of increasingly restrictive legislation concerning reproductive rights. Professor Nicole Huberfeld, of Boston University's Healthcare Law Department, a seasoned observer of legislative attempts to restrict abortion access, notes that such efforts often employ creatively restrictive tactics. She cites examples like mandatory transvaginal ultrasound requirements or laws mandating abortion clinics to adhere to the licensing standards of ambulatory surgical centers requirements that often disproportionately impact access to care and inquiry. Senate File 125, in its broad and vaguely worded restrictions, appears to follow this same pattern of obfuscation and aggressive limitation, potentially undermining the health care rights of Wyoming citizens in the process. The bill's implications extend far beyond abortion, posing a significant threat to the accessibility and provision of a wide spectrum of essential medical services. The potential consequences for patient care and the overall healthcare landscape in Wyoming remain a grave concern.